So I want to talk to you about ELSI 2.0, which is a new initiative which really could potentially underpin a lot of the ELSI work that's going on. Thank you. So, can I have control of them too? It's not working. Keyboard, this little one, okay? We've got a few bits of technology moving here, mainly because I want to give you a demonstration. So what I'm going to do is just address the issue, why do we need ELSI 2.0, what it is, what we've achieved so far, what are the objectives for the coming year, and then just do a very quick demonstration of the e-workspace that we've developed. So why did ELSI 2.0 come about? Basically, a group of us got together and were very concerned that, in actual fact, a lot of the academic scholarship was siloed. So it was siloed by disciplines, siloed by geography, but also siloed by the fact that it wasn't really, there wasn't a quick way into policy. So there was all this work being done, but it actually wasn't being moved into policy quickly, but also that stakeholders and people who had an interest in ELSI issues in genomics actually weren't being involved in the process. So, for instance, patient groups, the general public, the communication between researchers and people who were specialised in ELSI wasn't necessarily happening all the time. And the issue was that we also had science being developed at an international level, being carried out at an international level, but in actual fact, ELSI wasn't being done at an international level as well. Also, when you started to look at the knowledge base, you realised that a lot of the ELSI focus got concentrated on key areas, long debates around consent. Biobanking actually hasn't featured as much as I thought it would, but this was just kind of a quick search that I did on PubMed. So also another key thing is that a lot of interactions between ELSI people and people concerned about these issues and the way that new opportunities might arise would actually be done in a very serendipitous way, so that it was a lot of chance factors coming into play. And so it was an agreement that actually we needed to start to think, plan and manage, and maybe think about how we could coordinate some of these activities across a global level. And there was real concern that, in actual fact, because we weren't doing this, we were actually leading to a lot of lost opportunities, but also wastage of resources and effort. And another key factor was a realisation that a lot of resources were being put into ELSI activities within the West, but not in other countries. And this meant that there was a lack of diverse voices in this field, and something that we really needed to address. So really the vision of ELSI 2.0 is really thinking about a new way to work, a new way to come together to actually do ELSI in a very creative new way, and the potential to bring networks of people together working on different aspects of ELSI inquiry, but bring them together in a new way, and to do this globally, so we could actually focus on global policy. So what is ELSI 2.0? First of all, it's an infrastructure to engage and enable a broad range of stakeholders to actually share expertise, ideas and approaches, and to facilitate and sustain global collaborations and networking, so that we can actually influence policy and scientific practice at a global level, so that we don't have pockets of good practice where it's not shared. And also to develop new ways of working, including using 2.0 technology. So there's two key ideas in ELSI 2.0. So 2.0, which is really a change in technology moving from static web pages to dynamic or user-generated content, and the growth of social media. And I think everyone in this room knows about that. But it's also a move towards a more social, collaborative, interactive and responsive web. And also, I think we would also agree that there's been a change in the philosophy of society as a whole. So what is a collaboratory? This is what we are setting up. It's a fusion of the words collaboration and laboratory. It's a combination of technology, tools and infrastructure to allow remote collaborative working. So working without walls and not being constrained by the fact you have to be in the same place at the same times. And so this is really seen as a culture change project, a new paradigm for conducting ELSI that enables stakeholders from any field to easily access expertise and knowledge and to work together. So we came up with this concept, which was published in Science in 2001. And the collaboratory is there. And so from that template, we've actually started to work on this blueprint. So we've established our international steering group. And this, oh, I'm sorry, sorry about that, animation's got completely messed up there. But also the big thing that we're working on at the moment is the collaboratory and developing an e-workspace. So what have we done? We had our kickoff in Rotterdam in June 2012, which was followed by a launch of the Asia Network in Osaka in 2013. 32 people came from 9 countries, and we actually had Kelly Edwards joined by OmniJoin, which is our web conferencing facility. And I think that this network will continue to grow. We also had a launch in the UK and a launch in the US in May 2014. And next week in Oxford, we're actually having the launch of the Early Career Researchers Network, with the aim that we actually bring in a group of people who can start to really push this idea of working together globally and working on the e-workspace. And that has been supported by a cost action called ChipMe. In addition, we've had a number of topic meetings. So Bartha led a workshop which was on safe harbours in September 2013. And a number of papers have come out of that. And I like to think that it also contributed to the framework on data sharing. In November 2013, we had a meeting on incidental findings in biobanks, which is leading to a special issue. And we also had another OmniJoin meeting, which was on data protection with experts in Tokyo and the UK. In 2014, we had Data Sharing Consortium, and in Hobart, there was a meeting on personalised medicine. Next year, we're actually having our first international conference, which will be focused on translation in healthcare. And there we're going to launch our e-workspace, but also we are going to see how we can actually develop new ways of having a conference. Because I don't know about you, but the time which I get the most out of at a conference is actually in the tea breaks when you can talk to people. So how do we turn a whole conference into a tea break with those opportunities for networking? Also, we are having another meeting in Toulouse in December. So what are our objectives? The aim is to build a, sorry, I think I've just skipped. Yes, I've skipped too much. Our objectives, can you move me back? Yes, doing that. Anyway, our objectives are to establish the e-workspace, to get our graduate network established, and to also, thank you. No, God, it's fine. And also to actually start to reach out to the broader community. So I just wanted to show you and give you an example of our e-workspace. And I'm just going to, I'm not sure. There's Sarah. But I just wanted to show you the e-workspace. We've had some fun with our technology, as you can see. I'm just going to put Sarah down there for a minute. So, what the e-workspace can do is actually handle Twitter feeds. It can actually enable people to meet. It actually gives information about the steering committee, what we do, but also our members. And our aim is that we actually start to get people from around the world, and that we kind of lose that concentration in North America and in the UK. One of the things about this site, which has been supported by the Global Health Network, and I must say, I must give my thanks to my colleagues there, is actually the fact that you can, sorry, I'm just waiting for it to load. You can actually, just go back. What you can do is actually translate the site. And I'm going, what language shall we have? I'm going to go with Japanese, because my colleagues, there's a number of people from Japan here, and I'm very appreciative of the fact that they've come so far. So we can actually then go and have a look at the site. And it will translate into Japanese. And this, I think, is a great advantage for actually reaching out to many people around the world. So I'm just going to turn that off. So what I wanted to show you was just one of our activity zones. And the idea is that we can actually set up some zones where people can come together, and using 2.0 technology, we can actually really start to interact and work on a global level. So we've got topic groups, of which biobanking is one, and event groups. And and I'm going to actually just go into the genomic sovereignty, because this is what we have live at the moment. So this is very much a prototype, and we're going to be working on this for a while to make it work well. But as you can see from this, you can actually start to post a discussion. So you can have a series of conversations going, if that would be appropriate for your group, allowing people to actually interact. You can also share papers and make comments on them. And because it links into the Global Health Network, there's the potential to share resources more broadly than just our community. And also, if all goes well, and this is thanks to our collaboration with Brother, you can click through, and then you can reach through and see Sarah in Oxford and Jess over there in the room. So the idea is that actually we can really move to a point where we're interacting in a meaningful way. It's really important to have face-to-face meetings, but it's also really important to have tools that can keep that collaboration going. So our e-workspace is really one of our priorities for the coming year. We're going to launch it in June next year. And then we're going to start, in the following year, we're going to start focusing on our accelerator and really starting to look at ways where we take collaborations into policy. So thanks.